Another way of classification is anatomical classification of brachial plexus injuries, divided into preganglionic and postganglionic. Postganglionic distal to the dorsal root ganglion. Preganglionic is a root eversion. Poor prognosis of preganglionic injuries and little prognosis potential to regenerate. Irreparable. Lesions suggesting preganglionic injury: number 1, Horner syndrome; number 2, winging of scapula; number 3, elevated hemidiaphragm; number 4, weakness of latissimus dorsi, thoracodorsal nerve. Preganglionic is present with motor deficit and flail arm. There is sensory deficit as well. There is absence of tendon sign or tenderness at percussion in the neck. Histamine test: drop of histamine placed on the skin and scratch through it. Normally response is vasodilatation and wheal formation. It is normal if the injury is proximal to the dorsal root ganglion. A normal test will denote preganglionic injury. Horner syndrome: disruption of sympathetic chain, appears 2 to 3 days following injury. It basically signifies T1 root lesion. Ipsilateral meiosis, pupillary constriction, injury to the long ciliary nerve. Anhidrosis, dry eye. Ptosis, drooping eyelid, because the nerve to mother muscle is affected. In ophthalmos, sinking of the orbit.